Good morning, gentlemen. Welcome to another day of Climate Chronicles. Today is April 2nd, 2020. And I wanted to address Dave's comment yesterday with the following article from this morning's LA Times. The shaky science behind Trump's chloroquine claims by Michael Hiltzik. Jennifer Herrera is down to her last 15 days of a drug she needs to control her inflammatory arthritis. Her pharmacy is out of stock and has no idea when its next shipment will come in. Her misfortune is that she's dependent on a version of chloroquine, a drug touted by President Trump and others as a treatment for COVID-19, the disease caused by the novel coronavirus. Pharmacists have been telling patients with arthritis and lupus, an autoimmune condition treated with the drug, that retail supplies are short, if not currently non-existent. On Tuesday, the Food and Drug Administration placed 2 formulations of the drug on its list of drug shortages. Meanwhile, doctors have been reported to be writing prescriptions for chloroquine for themselves and their families, and prescribing it as an off-label treatment that is unapproved by the Food and Drug Administration. For the purpose, but legal for doctors to prescribe for patients facing COVID-19. It's like the toilet paper shortage, Herrera, 72, told me, but this is medication. Sanofi, the lead manufacturer of Plaquenil, the hydroxychloroquine formulation Herrera takes, says it doesn't anticipate shortages of the drug due to COVID-19. Novartis, which makes a generic version of hydroxychloroquine, says that it continues to fill orders at historical levels for existing customers to ensure supply for patients that are most in need. Several states have tried to put a leash on diversions of chloroquine preparations. Michigan health officials, for instance, have threatened doctors with administrative action for prescribing or stockpiling chloroquine-based medications for themselves or family members without a legitimate medical purpose. There are scientific grounds for examining chloroquine and hydroxychloroquine as possible treatments for COVID-19. Infectious disease experts consider the drugs to be promising, but there's a lot more they'd like to know before certifying them for clinical use. One trial underway at the University of Minnesota aims to recruit 3,000 subjects from among healthcare workers and their household members who have been exposed to infected persons or are showing symptoms or have disease or have been diagnosed with the disease. Half the subjects will be given chloroquine. Preliminary results may be available by April 21st. Yet generally the hype has run so far ahead of scientific knowledge that red lights should be flashing and danger sirens sounding. Chloroquine is dangerous when not taken under a doctor's rigorous supervision, and its shortage can cause life-threatening consequences for lupus patients and serious health effects for rheumatoid or inflammatory arthritis patients. The bottom line is that evidence for chloroquine's effectiveness in COVID-19 is unsubstantiated. It derives heavily from the work of a controversial French expert in infectious diseases, Didier Raoult, whose studies on the topic have been criticized as inconclusive. The craze has been pumped up by figures who have a large public platform, including Trump and Dr. Mehmet Oz. Trump promoted Raoult's claim about a drug cocktail containing chloroquine and the antibiotic azithromycin at a public briefing March 20th and tweeted about the drugs on March 21st. Hydroxychloroquine and azithromycin taken together have a real chance of being to be one of the biggest game changers in the history of medicine. Dr. Oz, a prominent heart surgeon whose television show is a platform for dubious health advice, interviewed Raoult on March 23rd and subsequently discussed his research on Sean Hannity's Fox News show. On the latter, he said Raoult had shown he could get rid of the virus in 6 days in 100% of patients he treated. That is not remotely true, as Raoult's own published paper reveals. According to his paper, several subjects dropped out because they got sicker. – 1 died. But he didn't include their cases in his results. Other studies in scientific literature have been inconclusive about the effects of chloroquine or found no effect. Trump's failure in the coronavirus crisis have been largely sins of omission. No planning, no organization, no leadership, with the result that the toll in the U.S., as these words are written, has risen to more than 210,000 reported cases, the most in the world, and about 4,700 deaths. The chloroquine case is different. It's a sin of commission. Trump has openly offered the public a false hope, or at the very least a completely unproven hope, while his words have led to a situation in which legitimate patients have been deprived of what is in many cases a life-saving medicine. Chloroquine is by no means a benign drug. It's known to contribute to macular degeneration, which can cause blindness. It's also known to cause heart problems in some cases, according to the French journal Le Point. These have already surfaced in France among patients treated with chloroquine. The French Drug Safety Agency, ANSM, says it already has 3 deaths under investigation. The drug isn't recommended for diabetics, pregnant women, or people with impaired liver functions, among many others. Among its possible side effects are nausea, vomiting, cramps, headache, and diarrhea. Trump's trumpeting of chloroquine may have encouraged at least one fatal outcome. As we reported, a Phoenix couple who heard Trump's briefing took doses of a chloroquine preparation they had at hand to treat their fish tank. The husband died and his wife landed in critical condition before recovering. In the current atmosphere of panic and confusion, it's up to our political leaders to offer hard, verifiable scientific information and solid advice, not ignorance. Trump, who is not a doctor and doesn't even play one on TV, could be doing real harm. So I encourage you to read this article this morning on the LA Times, and I will post a picture following this video. But again, I reiterate. Actually, let me just finish this article. Why is this happening, says David Gorski, a physician who is a leading debunker of pseudoscience. People are scared, for one thing. Dangling hope of an imminent cure helps distract from coverage of Trump's administration's thus far disastrous response to the COVID-19 pandemic. That brings us to Raoult, the politically well-connected researcher, heads a Marseille-based medical institute known for its remarkably large volume of published papers. He casts such a large shadow in the French research community that many of his critics will only speak out anonymously, as the journal Science reported in 2012. In 2006, however, the American Society for Microbiology banned Raoult and 4 of his co-authors on a paper from publishing in its journals for a year after finding that some of the data appeared to be misrepresented. 2 of the co-authors accepted blame for the errors, but the society said it was not entirely comfortable with the explanation provided. Raoult called the punishment unfair, claimed he hadn't even checked the submitted paper, and labeled himself a collateral victim of a collective sanction. Raoult didn't respond to an emailed request for comment. Raoult is a climate change denier. Climatic predictions are absurd, he said in 2013, and the Earth is no longer heating up in 2014. He also expressed skepticism about the coronavirus in a video recorded at his institute in January. The world has become completely crazy, he said. 3 Chinese die, and that creates a worldwide alarm. All that is crazy. That should provide some perspective on Raoult's chloroquine research, which has been criticized in the scientific community for its methodology and claims. Raoult's initial paper, the one cited by Dr. Oz on Hannity's show, involved 26 patients receiving hydroxychloroquine alone in a combination with azithromycin, and a control group of 16 receiving no treatment. During the first 6 days of treatment, 6 patients fell out of the sample. 1 died. 3 were transferred to an intensive care unit. Another left the hospital for unstated reasons, and the 6th couldn't stomach the drug. Those 6 results, however, were not included in the results, meaning that Raoult, quote, cured, unquote, only 100% of those who didn't get sicker or die or leave the study. This is not how things are done, Gorski observed. These patients were obviously sicker. Leaving them out of the final analysis was not justifiable. Falut followed with another paper describing a study of 80 patients at a hospital associated with his institute with no control group. But the 80 patients appeared to have very mild infections. Only 15% had a fever, and 4 showed no symptoms at all. Some experts say that using drugs such as chloroquine with potential antiviral action on patients with mild symptoms or in early stages of the disease could be appropriate to keep the disease from progressing. But as Gorski says, patients with mild COVID-19 infections often recover without medical intervention. So it's difficult to pinpoint the effect of Raoult's treatment if it has any effect at all. Responsible scientists and government officials are doing what they can to hold back the tide of pseudoscience in the chloroquine affair. Asked at a March 20 White House briefing if there was any evidence to suggest that chloroquine could be used against COVID-19, Dr. Anthony Fauci, the nation's trusted authority in the current crisis, replied, "No, the answer is no. The evidence being mustered thus far," he said, "is anecdotal." Anecdotes are not facts. Nothing that Trump, Dr. Oz, Sean Hannity, or Didier Raoult can say can change that. But their efforts could cost lives. Eduardo Rivera.